My name is Emma Jabrowski and I'm 16. Today is December 18th. Tomorrow I have surgery to remove a tumor from my parotid gland. I felt swollen there behind my ear and went to children's ears, nose, and throat and started antibiotics. That didn't work, so I got an MRI that confirmed the tumor in July and then an FNA that confirmed that it was benign. I tried to heal naturally and to build up my immune with supplement juicing and organic diet. Insert high and low for an expert surgeon. Obviously, it's grown, and I still feel fatigue and occasionally ache there, and I'm ready for the next choice, which is surgical removal tomorrow, the 19th of December, 2013.
This is Emma checking in. And I know Inns are thinking that we are in Italy. Okay. But no, we're not. We're at the hospital, Montefiore, and we made it here 4 minutes early, 6:40 a.m. Okay, so you got checked in. Mm-hmm. Was it easy? Mm-hmm. Okay, and you got a little band now so far? Mm-hmm. Okay, it identifies you. Anything you want to say? So what? We're just waiting?
Yeah.
That's all for pre-op.
Yeah. It's going to be a really slow hour.
Did I stop it, hon? Hi.
Hi.
Okay, so we have an update, and today is December the 19th, 2013, and surgery this morning started exactly at 8:40, and it lasted for 1 hour till 9:40, and then the doctor called to say that the tumor was easily removed successfully with no permanent nerve damage, and that the tumor had grown with one nerve over top of it, and that nerve had to be moved for the tumor to come out. So there is some temporary, what's the word I'm looking for? Can't think
Paralysis?
of it. No, not at all. Temporary with the nerve. It will fully come back. And 3 hours was spent in the recovery, and we're now in the patient's room.
It's nice in here.
And we're resting peacefully. It's 4:45. Emma hasn't taken pain medicine for quite a while. So tell me what pain level you're at on a scale of 1 to 10.
I don't know. Probably like a 4.
A 4. And do you feel pain? Show a point where you should have pain.
I kind of just have it in my neck because I can't sleep on because of this thing here.
Okay, so that's a drainage tube.
Here.
That's a drainage tube. And the drainage tube is just to make sure that there isn't any fluids that settle that cause any kind of an infection. It actually looks really good. And you're just going to let rest and we'll check in later.
Okay.
Good morning, Emma.
Good morning.
How are you doing?
I'm okay.
Okay, so it's 24 hours, which makes it 8:45. You went in at 8:40, so 24 hours since you had your surgery. Really, the tumor wasn't taken out for another hour, so you're about 23 hours since the tumor came out. And how are you feeling?
I'm in some discomfort.
Okay. Discomfort, such as?
My head hurts and just the side of my face.
Okay, so the right side of your face, from your forehead down?
Yeah.
Okay, it's a little achy, but you're not taking any pain medicine. No, so you had a Tylenol.
Yeah.
And you feel a little nauseous because you're not really up and moving around. So when you do move around, you feel a little nauseous.
Yeah.
Okay. So then the drainage tube is going to come out, which means they have to cut a little stitch in the back, and then they pull the tube from that little area, and probably put a little piece of tape back on it. And that's the most uncomfortable thing for you right now. So right after that happens, and they probably will remove the IV, and then we'll check in later.
Okay.
Okay, but you look great.
Thank you.
There we go, honey.
Hey.
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 So today's December 31st, the last day of the year.
Yep.
And we just came from our post-op visit, so it's a follow-up, first follow-up with Dr. Jonas Johnson from Pittsburgh, Pennsylvania, and Oakland at the Ear, Nose, and Throat Institute. And so basically the results is pleomorphic adenoma, meaning benign tumor, not cancer.
Yay.
So very thankful for that. Tumor-free, cancer-free. So we have a lot to celebrate this New Year's Eve.
Yeah.
And so he went ahead and took the remaining tape off. So the incision now can be seen clearly. Turn your head. Okay. So where the incision started at the top, pretty close to the top there, and then I know you can't move your lobe, so we'll just move the hair, and that's what it looks like at this point. And then in here we have a drainage hole.
I don't know where that is.
Turn your head my way, though, something. And
somewhere in there.
There it is. So that's a little drainage hole not far away from the ear. And everything is checking out 100%. He does still expect
Full recovery.
full facial movement, but he just doesn't know how long. So at this point, do you have any negatives?
No.
What do you feel? And so show us where your numbness still remains. Kind of draw a perimeter. Starts there and goes. Okay.
Yeah. And then go around.
Okay. So it's numb, but it's painful. It hurts to the touch.
Yeah, it's uncomfortable.
So you don't feel pain unless you're touching it.
Yeah.
Or not pain.
I took out 150 calls.
So you've been out in the weather.
Yeah.
And how does it
The
feel?
cold feels weird on it because I can't really feel it. You can feel it, but it's numb.
Okay. Okay. And so other than that, sleeping well, showering.
Yeah,
Okay.
everything's really easy.
And then
now.
where's the pain inside your ear? You actually feel pain in your ear at all, or no pain? Can you chew
Just like here.
only when you touch it?
Yeah.
Or when you yawn?
Yeah, it's only when I touch it.
Just when you touch it. So in
Yeah.
other words, you don't feel any pain unless you're actually in the weather or touching it.
Yeah.
And eating?
Eating's good.
How far can you open up your mouth? So is that halfway?
I don't know. It feels pretty open.
Okay. And then your eyes a bit
Saggy.
because there's no nerves holding it up. Okay. And then your smile. Okay. So, and again, all that should come back fully. He expects it. And there's no other returns. So, as of today at 8 a.m., we were at, well, I'd have to count the days, but let's put it this way. Thursday around 8 will be the completion of 2 weeks.
Yeah.
So what's that put us at day 12 today then, roughly, I think?
Yeah, today's day 12.
12 complete days at this point.
Yeah.
Yeah.
Time flies.
So, yeah, okay. So anything you would like to let your viewers know about the surgery and the whole experience?
Stay positive and surround yourself around positive people who will make you happy.
That's right. And let people know so they can pray for you. That's most important.
Because the best recovery is to constantly have a smile.
Yes,
Makes you
laughing.
feel, yeah.
Yeah, that's true. It does work. And time off from school, you missed 2 days of school because you've been on Christmas vacation.
Yeah.
And so not having that stress of worrying about
school, yeah.
work. And you generally would sleep. Once you went to bed at night, you slept 8, 9, 10 hours straight.
Yeah, sleep's really important.
Because you kept busy during the day with company, friends, staying alert. Okay. So any ending remarks then to any of your viewers?
Have faith.
Yeah, have faith it'll all work out. Because I tell you, we worried more than
we probably ever should have.
Yeah. Do you think that you would wait as long? I mean, we did. We had a 6-month wait before we decided.
I think if you're unsure, it's good to wait.
If you're
to
unsure.
feel positive in medical practice and
Baby girl, that's enough. Yeah. And find a very experienced doctor, and that's the most important
Yeah.
thing, to have your total trust in the doctor come that day of surgery. Okay.
Okay.
All right. Happy New Year.
Happy New Year.